The next complementary course would be to take the functional indirect techniques, because you have direct techniques with muscle energy, you have indirect with the functional techniques, and those two methods are going to allow you to treat out a lot of patients. And then from there, that's basically taking all the muscle energy, upper and lower half of the body, and treating it out indirectly. From there, that indirect method can then be applied to the cranial techniques, and then basically you now have the indirect of the whole body.
And the other thing is that once you understand muscle energy and going directly against the restrictive barrier, then it's basically the same position you'd put them in to do high velocity techniques. And then because you understand the functional techniques and the functional feel, you can fine tune the positioning for the high velocity techniques so that you use very minimal thrusting forces, so it can markedly expand people's skills with high velocity techniques.
And another course that is important then after that would be the sequencing course, because it allows you to then put together all of these techniques and apply them very specifically and uniquely to each individual patient, finding that key area, allowing you to blend in, working on your palpation skills, your blending skills, to be able to treat them uniquely and find those key areas.
And once you find that key area and the patient is screened to find that, I think the message the patient gets is that you are looking at that patient uniquely as a very complex, unique, one-of-a-kind individual. And that has a profound effect on the patients. And they realize you're not cookbooking the care. They're getting some real unique care that's appropriate for them.
And we also have another course called the systems course, where it allows us to understand how the viscerosomatic, somatovisceral reflexes work together, and how treating the somatic dysfunction has a profound effect on the whole mesokinetic system, the whole myofascial system, and that allows you to have the language to explain to your patients what you have treated in them, how you have treated them uniquely, and what was wrong with them in the first place. It gives them a freedom and a relief of knowing what was wrong and how they're...
Well, in many patients, when you do that, the comment they have, they said, the way you treated me and the way you explained to me what you found and how it applied to my clinical picture is, this is the first time anybody ever gave me any hope.